Bonjour tout le monde. Merci d'être présent avec nous ce matin. J'ai la chance d'être accompagné de la docteure Theresa Tam, qui est la ministre en chef de l'Agence de la santé publique du Canada, du Dr. Howard Njoo, qui est administrateur en chef adjoint. Nous sommes aussi en contact avec ma collègue Anita Anand et évidemment notre cher collègue Navdeep Bains. Tous vont intervenir, mais on va commencer par vous, Dr. Tam.
Bonjour tout le monde. There have been 337,555 cases of COVID-19 in Canada, including 11,521 deaths. Nationally, there are close to 57,000 active cases across the country. And over the past week, labs across Canada have tested an average of over 75,500 people daily, with 7.6% testing positive. Yesterday, 5,713 cases were reported nationally. In addition, there were over 1,300 new cases reported for Saturday and Sunday. This brings the average daily case count to over 5,050 cases for the past week. The number of people experiencing severe illness continues to increase. Over the past 7 days, there were on average over 2,000 individuals with COVID-19 being treated in hospitals, including over 415 in critical care, and an average of over 70 deaths were reported each day. Following last week's epidemiology and modeling update, it's clear that we need to strengthen our response, specifically to bring down the rapid rate of growth. We need to combine a range of public health measures with tightened prevention practices by individual Canadians. In many ways, we have more to bring to this round of the effort in terms of experience, tools, and knowledge, but things are different this time. There are more regions of the country with high infection rates, and it is clear that COVID-19 knows no bounds. Communities, jurisdictions, and whole regions that were little, if at all, impacted in the past are now seeing community spread. Some areas are experiencing very high rates of infection for the first time. Nunavut has implemented territory-wide restrictions. Some of the Atlantic provinces have seen an increase in cases, and the Prairie provinces now have some of the highest infection rates in the country and are feeling a heavy strain on the healthcare system. There has also been a change in the age trend. In the early days of this resurgence, we saw high rates of infection among young adults. Now we are seeing an increase in rates in older adults, aged 80 years and older, who are at much higher risk of serious complications and death. Although it is still too early to know the impact of strengthened public health measures implemented in areas across Canada, we do know from the experience of many other countries that to be successful, a package of measures is required. It's not one size fits all. More importantly, we know that public participation is vital to success. This is why, as public health authorities implement measures to interrupt spread, Canadians are being called upon. It is safest for all of us to limit errands and outings to the essentials, limit in-person activities to our existing household members, and keep up with key prevention practices. Stay home if you have symptoms, practice physical distancing, frequent hand washing, wear a face mask in indoor public places, and avoid the 3 C's, crowded places, closed spaces, and close contact situations whenever you can. As we head into the holiday season, I know that things will be different and difficult choices will be required. Let's focus on the things we can do, including doing our utmost to protect our families, friends, and communities. Thank you.
Bonjour à toutes et à tous. Il y a eu 337 555 cas de COVID-19 au Canada, dont 11 521 décès. À l'échelle nationale, il y a près de 57 000 cas actifs. Au cours de la dernière semaine, les laboratoires dans l'ensemble du Canada ont analysé les tests de dépistage de plus de 75 000 personnes en moyenne quotidiennement, dont 7,6 % ont obtenu un résultat positif. Hier, 5 713 cas ont été signalés au pays. En outre, il y a eu plus de 1 300 nouveaux cas signalés samedi et dimanche. Cela porte le nombre moyen de cas quotidiens à plus de 5 50 cas la semaine dernière. Le nombre de personnes gravement malades continue d'augmenter. Au cours des 7 derniers jours, en moyenne, plus de 2000 personnes atteintes de la COVID-19 étaient soignées dans les hôpitaux canadiens, dont plus de 415 se trouvaient dans des unités de soins intensifs. Plus de 70 décès ont été signalés en moyenne chaque jour. À la suite de la mise à jour des travaux d'épidémiologie et de modélisation de la semaine dernière, nous devons de toute évidence renforcer notre intervention. Pour réduire les taux de croissance rapide, nous devons en particulier combiner un éventail de mesures de santé publique à des pratiques de prévention renforcées par chacun des Canadiens. À de nombreux égards, nous pouvons contribuer davantage à cette série d'efforts en ce qui a trait à l'expérience, aux outils et aux connaissances. Toutefois, les choses sont différentes cette fois-ci. Davantage de régions au pays connaissent des taux d'infection élevés et il est évident que la COVID-19 est sans limite. Des collectivités, des administrations et des régions entières qui avaient été peu, voire pas du tout, touchées par le passé, signalent maintenant une transmission communautaire. Certaines régions sont aux prises avec des taux d'infection très élevés pour la première fois. Le Nunavut a mis en place des restrictions pour l'ensemble du territoire. Certaines provinces de l'Atlantique ont connu une augmentation de cas et les prairies ont maintenant le taux d'infection le plus élevé au pays et leur système de santé subit des pressions importantes. La tendance relative à l'âge connaît également des changements. Au début de cette recrudescence de la maladie, des taux d'infection élevés ont été signalés chez les jeunes adultes. Nous observons maintenant une augmentation des taux chez les adultes âgés de 80 ans et plus, qui sont plus à risque de complications graves et de décès. Bien qu'il soit encore trop tôt pour connaître les effets des mesures de santé publique renforcées qui sont mises en œuvre dans les régions partout au Canada, nous savons, en nous fondant sur l'expérience de nombreux autres pays, que pour qu'elles fonctionnent, un ensemble de mesures sont nécessaires et elles doivent être adaptées selon la situation. Le plus important, nous savons que la participation du public est primordiale à la réussite. C'est pourquoi les mesures que les autorités de santé publique mettent en œuvre des mesures pour freiner la propagation. Les Canadiens sont appelés à contribuer. Pour la sécurité de tous, il faut limiter à l'essentiel nos courses et nos sorties. Limiter les activités en personne aux membres de notre ménage et continuer d'appliquer les principales pratiques de prévention. Restez à la maison si vous éprouvez des symptômes. Pratiquez la distanciation physique. Lavez-vous les mains fréquemment. Portez un couvre-visage dans les lieux publics intérieurs et évitez les becs, les endroits bondés, les situations de contact étroit et les espaces clos, chaque fois que vous le pouvez. À l'approche des fêtes, je sais que les choses seront différentes et que des choix difficiles seront nécessaires. Concentrons-nous sur ce que nous pouvons faire, notamment déployer tous les efforts pour protéger notre famille, nos amis et la collectivité. Merci.
Merci beaucoup, Dr. Tam. Merci, Dr. Njoo. J'aimerais inviter Mme Anand, Anita, à intervenir.
Madame Anand, c'est à vous. Mr. Anand, I think you're still mute.
Good afternoon. I would like to begin by thanking all of you for limiting your in-person contacts and following public health advice. We know how important it is to follow this advice to slow the spread of COVID as we await the arrival of safe and effective vaccines. I will provide a brief update on the logistics that we are implementing for Canada's COVID-19 vaccine rollout strategy. For many months, alongside our efforts to purchase vaccines, we have been preparing for the administration and distribution of vaccines. We know that vaccine distribution will be complex, especially in light of the need to transport and store vaccines at specific temperatures. We continue to work with the provinces and territories to ensure that we are prepared to securely and efficiently deploy vaccines to Canadians across this country. The process of rolling out a vaccine from a procurement perspective has three phases: regulatory approval, distribution, and administration. On regulatory approval, 3 vaccine candidates have begun rolling approvals with Health Canada: Moderna, AstraZeneca, and Pfizer. This process will be rigorous, efficient, and based on science, not politics. La deuxième phase. Deuxièmement, quand on parle de distribution, nous continuons de travailler avec les provinces et les territoires pour nous assurer d'être prêts à fournir les vaccins aux Canadiens de tout le pays de façon sécuritaire et efficace. La semaine dernière, nous avons attribué un contrat de plus d'1,1 million de dollars à Fisher Scientific et d'un peu moins de 900 000 dollars à ESBE pour l'achat de 26 congélateurs ayant une capacité de congélation de moins 80 degrés Celsius et de 100 congélateurs pouvant fonctionner à moins 20 degrés Celsius. This procurement is in addition to existing federal capacity in this area. Overall, we have the capacity to store up to 33.5 million ultra-frozen and frozen vaccines. We are also seeking to meet additional needs based on the Public Health Agency of Canada's requirements for more capacity. These efforts include, last week, issuing a competitive request for proposals for supplies of dry ice for use in certain cold chain transportation and storage. We expect to award contracts as a result of this competition next week. Continue avec distribution. À la suite d'un processus d'invitation à se qualifier, mon ministère a également envoyé une demande de proposition à 4 soumissionnaires présélectionnés qui pourraient nous fournir une solution logistique complète pour la livraison des vaccins partout au Canada. Nous devrions être en mesure d'attribuer ou en plusieurs contrats d'ici début décembre. Moving on to the third phase. When it comes to the final phase of administration, we have already put in place a number of contracts that cover everything from needles to the sharps containers in which syringes are disposed after use, from vials to the gauze and bandages used after injections. We have a contract with Becton Dickinson for 90 million syringes. We have contracts for 70 million gauze, bandages, and alcohol swabs. We also have put in place contracts to ensure that Canada has leading edge equipment used to fill and finish vaccines, machines that are made right here at home in Canada. This is the 3 fill and finish machines from VanRx in Burnaby, British Columbia. In fact, to date, we have already received enough deliveries of syringes and needles to administer 24 million doses of vaccines, and we have tens of millions more en route. In other words, we will not cease in our efforts to ensure that when a vaccine is ready, Canada will be ready too. Nous poursuivons nos efforts pour faire en sorte que lorsqu'un vaccin sera prêt, le Canada le soit aussi. Finally, while Canada waits for a viable vaccine, our government continues to protect Canadians by procuring quantities of masks, gowns, and other PPE, and by making sure our healthcare system has access to treatments that support Canada's response. You know already that we have procured over 2 billion items of PPE for this country. And in terms of vaccines and therapeutics, we are also working on securing promising and effective treatments for COVID. In that vein, I am pleased to announce that we have signed an agreement with Eli Lilly for an initial order of up to 26,000 doses of its antibody treatment over the next 3 months. J'ai le plaisir d'annoncer que nous avons signé une entente avec Eli Lilly pour une commande initiale au cours des 3 prochains mois de plus 26 000 doses de son traitement pour anticorps. Eli Lilly co-developed this therapy with AbCellera Biologics, a Vancouver-based biotechnology company right here at home in Canada that researches and discovers next-generation antibody drugs to fight infection and disease. The partnership combines AbCellera's advanced antibody therapy discovery platform with Eli Lilly's manufacturing and distribution capabilities. Health Canada granted interim authorization for Eli Lilly's treatment last week. It is the first antibody treatment to be approved for use in Canada under Health Canada's interim order to expedite the review and authorization of COVID-19 drugs. This treatment has the potential to help patients with mild or moderate COVID-19 who are at risk of progressing to severe illness by improving symptoms more quickly and keeping them out of hospital. In conclusion, from procuring vaccines to PPE to testing to therapeutics, Canada will do whatever it takes for as long as it takes to get Canadians through this crisis. Qu'il s'agisse d'achats de vaccins et de EPI ou de contrôle des produits thérapeutiques, nous ferons tout ce qu'il faut aussi longtemps qu'il le faudra pour aider les Canadiens à traverser cette crise. Thank you, Megwetch. Merci beaucoup.
Merci, Anita. Navdeep?
Good afternoon, ladies and gentlemen, and mes collègues, les ministres Anand et Duclos, sont avec moi pour souligner cet autre jalon important de la lutte contre la COVID-19. As the Prime Minister announced earlier today, as well as my colleague, Minister Anand, the government has signed an initial order with Eli Lilly for up to 26,000 doses of their therapeutic. And this is especially notable because the technology behind the important treatment is distinctly Canadian. The key antibody for this therapy was developed by Canada's very own AbCellera Biologics. And I got to know AbCellera early on in the pandemic as one of our first made-in-Canada solutions to respond in the fight against COVID-19. Des meilleures entreprises canadiennes offrent leur expertise et leurs services afin de nous aider à répondre à la crise, et AbCellera est l'une d'entre elles. AbCellera's drug discovery technology uses innovative AI technology to search and analyze blood samples of recovered patients to rapidly find antibodies that can be used to fight and prevent viral infections. Using this innovative made-in-Canada technology, the treatment was developed from an antibody that was identified from the blood of a recovered COVID-19 patient. And in partnering with Eli Lilly, AbCellera's discovery will be brought to market commercializing a great Canadian innovation. So this truly is Canadian innovation on full display and on a global scale. And this will help save lives. Of course, in the long run, we want to see these great Canadian discoveries commercialized and manufactured right here in Canada. That's why in May, I announced a federal investment of $175 million to help AbCellera build an antibody manufacturing facility in Vancouver. This new facility, funded through the Strategic Innovation Fund, will be the first of its scale in Canada. And it will be capable of going from a patient sample all the way to manufacturing antibodies for clinical testing. So our government is a proud partner of innovative Canadian companies like AbCellera, and we will continue to strengthen our nation's capacity to respond to future pandemics for the protection of all Canadians. Thank you very much. Merci beaucoup.
Merci, chers collègues. Nous serions maintenant enchantés de répondre à vos questions.
Merci, Monsieur le Ministre. So as usual, we're going to start with questions in the room. We'll take 4 questions in the room and we'll turn to the phone. Madeleine?
Oui, bonjour, Monsieur le ministre Duclos et peut-être Dr. Njoo aussi. Je me demandais si la distribution des vaccins se ferait au prorata de la population des provinces.
Bien, merci pour la question. Et comme disait le premier ministre encore ce matin, cela fait partie évidemment des discussions très importantes que nous avons avec nos partenaires des provinces et des territoires. Nous sommes totalement sur ce dossier puisque nous savons que c'est aussi la priorité des Canadiens et des Canadiennes et bientôt il y aura plus de précisions qui vont être fournies.
De mon part, je peux aussi confirmer, on continue avec nos discussions avec nos homologues des provinces et territoires à l'échelle, comme on dit, opérationnelle, technique. C'est sûr, on a aussi des recommandations de notre comité consultatif d'immunisation aussi pour préciser c'est quoi les populations prioritaires. Donc, c'est fait partie de nos discussions avec les provinces et territoires.
Si je vous comprends bien, cette décision-là n'est pas prise encore. Donc, qu'est-ce qui doit être pris en considération? Est-ce qu'une population plus à risque dans une province ou s'il y a un plus grand nombre de populations à risque dans une province aurait un plus grand nombre de doses? Est-ce que vous pouvez être un peu plus précis, s'il vous plaît?
OK, merci. C'est Dr. Njoo. Oui, c'est fait partie. C'est sûrement la population d'une province, c'est un facteur, mais comme vous avez dit, il y a aussi des autres facteurs. On analyse aussi c'est quoi les proportions de la population dans chaque province et territoire qui font partie peut-être des populations vulnérables. Aussi, peut-être aussi les travailleurs essentiels. C'est fait partie de tout l'ensemble des facteurs on est en train d'analyser et discuter avec les provinces et territoires.
David?
Hi, everyone. David Thurton, CBC News. I know we're talking a lot about vaccines today and the new treatment, but I just wanted to ask a question about rapid tests. Several infectious disease doctors and epidemiologists are questioning Canada's lack of use of rapid COVID-19 tests. They say the approval is taking too long, and they point to several European countries that are using these tests to control the pandemic. So, Dr. Tam, why is Canada lagging so far behind when it comes to approving and using these rapid tests? Yeah.
So rapid tests or point-of-care tests have been actually utilized quite effectively in some of the more remote areas. So you're seeing it's used, for example, in Nunavut right now in the communities. Many of them are approved by Health Canada, and many of them have been purchased, and Minister Anand can sort of talk about that. And they have been provided to provinces and territories, including PCR and antigen tests. So I think certainly, I'm trying to remember the number now, it's probably close to 5 million rapid tests have been distributed to provinces and territories. We've provided guidance as well. So I think they're in the midst of trying to figure out their best use. But some of them are being deployed, for example, to the testing centers, and others might be used for more high-risk settings. So the specific implementation, though, is with the provinces and territories.
Yeah, Dr. Njoo, maybe just
And
add
I'll
to
just jump in there. Just to provide some of the procurement aspect to the rapid tests. So in total, the Government of Canada has procured more than 38 million rapid tests for the provinces and territories. We have distributed 4.6 million rapid tests to the rapid tests. So 4.6 million rapid tests have been distributed to the provinces and territories, with more on the way. That includes 2 million for Ontario, 1.2 million for Quebec, 300,000 for BC and Alberta, and 200,000 for Manitoba. And this is exactly the same process we've followed with PPE. Our job, and in particular PHAC's job, is to get this stuff out to the provinces and territories. And once they're in those jurisdictions, then the responsibility rests with the provinces to make sure they're used in those jurisdictions.
Yeah. It's Dr. Njoo, just to build on what Minister Anand said, that certainly when we're talking about rapid tests, I think we need to be clear that there's two types of rapid tests. There's the so-called molecular test, which is basically similar to the gold standard, the PCR molecular test that's in laboratories, and the so-called antigen test, which we also recognize from a sort of a sensitivity point of view, the characteristics are not quite as good as the PCR test. So as Dr. Tam and others have stated, we've actually received and shipped out, I think, by my figures, over 200,000 of the so-called Abbott ID now. That's the molecular rapid test. And certainly that's been used, I think, in good effect up north in remote and isolated communities. Certainly, they're being used in places like Nunavut right now. The antigen test, which we recognize needs to be used as part of an overall testing strategy. We've actually published guidance. It's out there. The provinces, territories know that the specific circumstances, we've said that before, maybe for frequent testing in certain high-risk workplace settings like meatpacking plants, certainly to be used in long-term care facilities, maybe at the beginning of an outbreak investigation and so on and so forth. So the tests have been distributed. Certainly, as Minister Anand said, over 4.6 million tests overall have been distributed to the provinces and territories. The guidance is out there. I think you'd have to ask the provincial and territorial authorities in terms of how they're actually being deployed on the ground. Thank you.
But yes, thank you. But I'm just wondering, is that it? And that's significant. And don't get me wrong there. There are other jurisdictions, such as the UK, that have approved, from what I understand, at-home kits. So there's more that other places are doing. Are we going to see something like that? Is this the it when it comes to rapid testing, or is there more approvals? Is there more work that you guys are going to be doing at the federal level? Because it's still a big issue.
Well, the regulator is doing everything they can, and there are other rapid tests that are in the pipeline which can be reviewed. And if a manufacturer of a truly home test applies, then they will be, and they're pursuing all of this, and again, Minister Anand might have further information, is that the regulatory approvals, they will work as hard as they can, and then, the acquisition as well. So no, this has not stopped. This is not the end. The 38 million is not the end. We will continue, I think, to work as hard as we can, also on other options.
Just as Dr. Njoo, I don't just build on what Dr. Tam has said, is that certainly, the whole approach of what we call, testing, tracing, isolation is an important part of the public health approach, but it's not the sort of be all and end all, in and of itself. We're not going to test our way out of this situation. It also depends on the individual behaviors of Canadians. We've stressed that so many times. The basic public health measures, both at an individual level and certainly what governments and public health authorities may need to impose as well. So certainly, the availability of testing is one thing and needs to be used to its best advantage, but it's not going to be a sort of the silver bullet on its own. Certainly, we're also hearing stories of people becoming tired, and not wanting to go getting tested and so on and so forth. So those are all other aspects we need to look at as well. So, I guess the actual availability of whatever technology, be it testing or anything else, is certainly an important part of it, but it's not sort of the whole solution.
Thank you, Dr. Tam. We'll take one last question in the room before turning to the phone. I know Dr. Tam is expected to be somewhere. I think Dr. Njoo will remain here to answer the following questions. Rachel?
Thanks. I thought you said we had 4 in the room initially, but this is Rachel Haynes here from CTV National News. I just have a question for the doctors of, can you give us an update on how close Health Canada is to approving these vaccines, the contracts that we have with Pfizer, Moderna, and AstraZeneca? How close are we to seeing those approvals?
That would be up to the Health Canada regulatory authorities. What they have done is to, special authorization from the perspective of the rolling submissions that you've heard about. So data as they become available is expected to be submitted to Health Canada. So I can't tell you the precise timing of what they will be doing. But of course, the paramount most important thing is that they are really rigorously looking at, they have to look at the data from the perspective of safety and efficacy and quality. The quality bit people may not understand as much is that depending on where the vaccine is produced, there's manufacturing quality assurances. There's even lot-to-lot reviews that has to happen as well, so further down the line. But they are also collaborating with an international coalition of regulatory authorities so that they can get that data as fast as possible. But I would not want to sort of intervene on the rigorous process that the regulatory authorities are doing. But they will be working as fast as possible. I know that will be 24/7. They've really boosted their capacity to do that.
The Prime Minister said, though, that he expects the delivery of vaccines in about early 2021. So does that kind of line up with the Health Canada timeline that you know of? Or are we going to find ourselves in a situation where Canada receives vaccines, but then we can't actually deliver them to Canadians because Health Canada hasn't approved them yet?
Well, I think, as I said, all hands on deck in terms of the regulatory review, but you want that to be done properly. Whether you can, lots of things are being done in anticipation of. So I'm sure we'll still be getting ready so that we can be, of course, if necessary, ahead of the game. But so all the pre-purchasing and logistics are done. But we want to make sure that every Canadian knows that whatever we are going to be authorizing would have undergone that rigorous process. But I think that as much as possible, people are trying to line up, the critical path.
I might just add, from a procurement process, our contracts with the vaccine suppliers contemplate Health Canada approval in order for the deliveries of the vaccines to occur. And in particular, vaccine suppliers are very conscientious about not having vaccines go to waste and making sure that they are used as soon as possible. And so we are very much in touch with suppliers so that when Health Canada approval has been granted, we are able to move very, very quickly on the deliveries into Canada. Thank you.
Thank you, Minister. We're now going to switch to the phone operator. Over to you.
Thank you. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from, la première question est de Mélanie Marquis de la Presse. Please go ahead. À vous la parole.
Merci beaucoup. Ma première question est pour le ministre Duclos. Ce serait pour savoir, je ne sais pas s'il est encore là parce que je ne vois pas sur mon écran. Monsieur Duclos, allez-vous nommer au fédéral quelqu'un qui va vraiment être responsable de diriger l'opération de vaccination, un peu comme ce que l'Ontario a fait, par exemple, en recrutant le général à la retraite, Rick Hillier? Allez-vous recruter quelqu'un ou ça va être un ministre ou un comité qui va être le grand maître d'œuvre de l'opération?
C'est ce qu'on appelle Équipe Canada. Évidemment, dans l'Équipe Canada, il y a le gouvernement fédéral qui, pour, comme on l'a entendu, l'accès, l'approbation, le transport, l'entreposage et l'appui à l'administration du vaccin, va jouer un rôle particulièrement important parce que les circonstances que l'on vit présentement en termes de pandémie COVID-19 sont des circonstances qui sont totalement inhabituelles dans un contexte habituel de vaccination. Mais c'est une équipe Canada parce qu'il faut travailler évidemment avec les provinces et les territoires. Mais pour le faire, nous allons effectivement utiliser toutes les ressources du gouvernement canadien, y compris les capacités significatives des forces armées canadiennes, les capacités très significatives d'approvisionnement auxquelles Mme Anand a fait référence tout à l'heure, les capacités du secteur privé aussi, que nous voulons mobiliser à sa pleine capacité au cours des prochaines semaines et des prochains mois. Donc, en gros, c'est une équipe Canada qui va fonctionner dans un modèle canadien de plein partenariat entre les différents gouvernements et les différents acteurs, à nouveau, incluant les forces armées canadiennes et le secteur privé.
Mélanie, en suivi?
Oui, vous me corrigerez, M. Duclos, si je me trompe. Donc, la réponse, c'est non, il n'y aura pas une personne qui va être recrutée pour diriger l'opération. But my follow-up is for Mr. Anand. I would like to hear about the freezers that the federal government has bought or is about to buy. How many do we have right now? How many have been received? How many can support the vaccine that needs to be kept at minus 25 Celsius? And where will they be located? Is there going to be like a freezer headquarter in Ottawa?
Merci beaucoup pour la question. Je vais répondre en anglais aussi. Listen, it's such a great question because what we are putting in place is an end-to-end logistics system to ensure that from the moment the vaccines arrive into Canada until they are actually administered to individual people, we've got the logistics system in place. And indeed, the freezers that you referred to are part of that end-to-end logistics system. In particular, what we have done so far is to secure 126 Panasonic and thermal scientific freezers for ultra-frozen and frozen vaccine storage. 100 minus 20 degree freezers and 26 minus 80 degree freezers have been secured. More than 30 freezers have already been received by the Public Health Agency of Canada, and deliveries are continuing. Each freezer holds hundreds of thousands of doses. With existing federal capacity, we can store approximately 33.5 million ultra-frozen and frozen doses at one time. We are also securing a supply of dry ice needed for this end-to-end logistics transportation system. The dry ice is going to aid in safe transportation of vaccines across the country. And so we're working very closely with the Public Health Agency of Canada to ensure that when vaccines arrive in Canada, they are safely stored and transported. Thank you.
Thank you, Minister. Dr. Tam has to go, but Dr. Njoo remains to answer your question. Operator, next question on the phone, please.
Thank you. The next question is from La prochaine question est de Tonda McCharles from Toronto Star. Please go ahead. À vous la parole.
Good morning. Minister Anand, if I understand then what you just explained, thanks for the clarification. If I understand it then, no matter that the delivery contracts would provide Canada with up to 6 million doses delivery by the end of March, if Health Canada hasn't approved, that vaccine doesn't arrive on Canadian soil. Is that what you're saying? I just want to understand it correctly.
Well, given that there is a very short shelf life to some of these vaccines, that is logically the case, right? And so, yes, that's the case. We've got to make sure that the timing of the deliveries is very closely tied to the timing of approval by Health Canada. And that requires constant communication with our suppliers. But the goal is to ensure that these vaccines are viable. And that means that they need to be safely stored once Health Canada approval has been granted.
And this is a different question than actually, maybe I'll drop that. I'm just going to stay with vaccines. The role of the military is unclear to me. As I understand it, the Deputy Defense Minister last week told a committee that the government hadn't asked, that the military doesn't have a role as of yet, but yet I understand that they may or are involved in the setting up of a national operations center to receive the vaccine. So I wonder if you can clarify what, if anything specifically, has the military been tasked with in this whole end-to-end chain you're talking about?
Well, thank you. I'll say a few words and then I'll let Jean-Yves step in if he wishes. I will just say that the end-to-end logistics system is a whole of government approach. All of our resources are on the table to ensure that when vaccines reach Canadians, they are deployed efficiently and as early as possible. And so this includes, from a procurement perspective, engaging a logistics provider to physically distribute vaccines to provinces. In addition, all options relating to other areas of government remain on the table. You will recall during the first phase of this crisis that we were very, very committed to utilizing all resources of government, and we continue to be committed to ensure that when vaccines arrive in Canada, they're safely and effectively deployed.
Yeah.
Jean-Yves?
So,
Dr. Njoo?
It's Dr. Njoo. Maybe I can add to that. Certainly, as Minister Anand has stated, it is a whole of government approach. Obviously, the federal government we're very seized with this very important initiative or project, as you might call it, and working closely with the provinces and territories. But I can speak more specifically to the Public Health Agency of Canada. We've stood up a very special team. I would call it maybe for lack of a better term at this point, a vaccine task force. And we've been working and been actively engaged with the Canadian Armed Forces. Certainly, we recognize they bring a unique skill set to the table, and certainly working along with our public health experts, with sort of the public health and medical aspects. For example, we recognize that in the area of logistics, certainly the Canadian Armed Forces bring a very unique expertise, and certainly that will be a major part of what I think will be part of the rollout of the vaccine. So I'll leave it at that for now. But certainly those discussions and those activities are ongoing as we speak.
Thank you, Doctor. Operator will now take one last question on the phone before turning back to the room.
Thank you. The next question is from la prochaine question est de Catherine Lévesque de la Presse canadienne. Please go ahead. La parole est à vous.
Oui, bonjour. Ma question est pour Dr. Njoo. On voit que Santé Canada a publié des directives pour le temps des fêtes, des directives qui sont, disons, qui viennent contredire ou qui sont plus sévères que celles qui ont été publiées par Québec la semaine dernière. Je me demandais, est-ce que la Santé Canada est en train de contredire le gouvernement du Québec ou de créer, ou qu'est-ce que vous dites en fait aux gens qui disent que ça ajoute de la confusion finalement au temps des fêtes?
OK, c'est Dr. Njoo. Merci pour la question. Oui, nous avons, comme des lignes directrices sur notre site web actuellement, à l'heure actuelle, pour donner aux Canadiens les conseils, qu'est-ce qu'il faut faire pour les fêtes. Je pense que le principe, c'est que vraiment c'est important de limiter le nombre de contacts. Les grands rassemblements familiaux, je pense que non, on ne va pas avoir ça. Ce n'est pas comme les fêtes comme des autres années. C'est mieux d'avoir peut-être des petits rassemblements vraiment avec seulement peut-être, si c'est possible, les membres de votre ménage. Aussi, même si on peut-être invite un ou deux autres, il faut garder la distanciation physique, le port de masque, tout ça. C'est intéressant parce que moi, j'ai eu une discussion aussi avec notre homologue de Québec, Dr. Arruda, et nous sommes sur la même page avec les principes aussi, avec les données probantes et la science. Mais je pense que l'approche de Québec, d'après moi, ce que je comprends, c'est il faut avoir aussi, comme on dit, la cohésion sociale. C'est comme, je pense que le premier Legault a constaté, c'est presque comme un contrat moral ou social avec la population de Québec. Et c'est sûr qu'il faut suivre, c'est quoi la situation pendant les prochaines 2 semaines. Le principe pour l'instant, c'est que si tout le monde est d'accord, la population, c'est vraiment aussi à l'échelle individuelle, que tout le monde peut-être fait, comme on dit, une auto-quarantaine ou isolement, quelque chose dans leur maison, peut-être 1 semaine avant les fêtes, pour vraiment limiter le nombre de contacts. Oui, c'est comme peut-être une petite récompense pour peut-être avoir des petits rassemblements, pas plus que 10 personnes, pour les journées le 24 jusqu'au 27. Et puis après, il faut aussi avoir une entente pour aussi limiter, aussi rester encore en quarantaine, auto-quarantaine pour la semaine après, avant comme les débuts peut-être encore l'ouverture des écoles, tout ça. Donc, je pense que ça, c'est une façon de peut-être trouver un équilibre entre un confinement total, parce que c'est vraiment dur pour tout le monde, et aussi donner un peu d'espoir, aussi avoir quelque chose pour tout le monde pour peut-être avoir une cible, un but, quelque chose, on peut travailler ensemble. C'est ça ce que je comprends, mais comme Dr. Ruda et moi on discuté, si la situation est vraiment grave, pire, peut-être même pire qu'aujourd'hui, peut-être vers, par exemple, le 27 décembre, c'est sûr, peut-être le gouvernement du Québec va encore peut-être ajuster les mesures. Merci.
Prénom suivi.
Oui, donc est-ce que le gouvernement du Québec a indiqué qu'il allait ajuster les mesures? Et puis, je veux juste réitérer, qu'est-ce que vous dites actuellement aux Québécois qui sont en train de prévoir leur plan pour les fêtes et puis là, qui sont confus là, par les nouvelles directives que vous avez publiées hier soir? Est-ce que vous dites aux Québécois, bien, suivez les consignes au Québec, suivez les consignes de Santé Canada ou allez-y avec votre niveau de confort? J'aimerais juste comprendre.
C'est difficile parce que oui, si on élabore les lignes directrices, c'est toujours, je comprends, à l'échelle de la population. Mais je pense, d'après moi, en fin de compte, c'est aussi vraiment une question de tolérance de risque, aussi gestion de risque, aussi, comme on dit, à l'échelle individuelle. Moi, j'ai déjà élaboré c'est quoi mes plans avec ma famille. Je ne peux pas dire qu'est-ce qu'il faut faire pour les autres personnes, mais pour moi, personnellement, je dis OK, peut-être qu'avec mon fils, peut-être ça peut même changer les plans, mais mon fils qui habite à Montréal, je dis OK, on va pas avoir un grand rassemblement familial avec toute la grande famille. Ma belle famille est québécoise, c'est sûr, je ne vais pas voir tout à l'autre côté, mais seulement avec les enfants. Avec mon fils, je dis OK, si toi, tu veux visiter chez nous ici à Ottawa, est-ce que tu es prête à faire comme une auto-quarantaine pour 14 jours avant de nous visiter? Restez dans ton appartement, seulement peut-être sortir pour l'essentiel, faire l'épicerie, c'est tout, les courses. Et c'est oui, je suis d'accord, je vais le faire, papa, parce que je veux vraiment te voir aussi avec ma soeur et mon frère. C'est OK, c'est beau. Et quand il arrivera chez nous, c'est aussi sûr que nous autres, tout le monde va porter un masque, et même à l'intérieur, garder la distanciation physique. On va avoir beaucoup de désinfectants des mains. On va garder toutes les mesures de santé préventatives parce que c'est ce que je comprends, c'est la meilleure façon de trouver l'équilibre entre les consignes, les conseils de santé publique, vraiment à une échelle individuelle. Ça, c'est mon plan. Je ne peux pas dire pour tout le monde. C'est sûr que tout le monde a peut-être des perspectives différentes, mais en fin de compte, c'est ça. Et je pense que le gouvernement du Québec essaie de faire la même chose. C'est sûr, on peut donner des lignes directrices pour toute la population, mais comme j'avais déjà dit, il n'y a rien de spécial si on met comme une limite de 10 personnes, 8 personnes, 12 personnes. C'est vraiment, il faut comprendre c'est quoi les principes qui soulignent les lignes directrices et après, il faut vraiment, je pense que mettre en vigueur, c'est qu'est-ce qui fait de sens pour comme dire, les situations à l'échelle personnelle.
Merci, Doctor. Back to the floor, and then we'll take one final question on the phone. Mia?
Mia Rabson from the Canadian Press. Dr. Njoo, why is it that 8 months into this pandemic, we still seem to have such little amounts of information about where people are actually contracting COVID-19? There's such a significant portion of cases that we can't say this is where it came from. Why do we not have that data?
Well, if we've talked about the issue of data, it's something obviously that's top of mind. We're constantly working with our colleagues in the provinces and territories. It's for certain that, yes, we could always be doing better. I think we've discussed the issue that there's certain types of data that maybe we haven't been systematically collecting, which I think highlight the fact that there are inequities in our society. For example, racialized Canadians, also individuals who are in certain socioeconomic classes that are deemed to be essential workers, don't have the benefits, sick days and so on and so on and so forth. So, for example, gathering more ethnic data and more detailed data about sort of housing situations, that I think is the ideal, and we're working towards that, but that's not the reality right now. So that's something we're working towards. In terms of getting data right now, in terms of, let's say, what you're, I think, alluding to in terms of the types of settings in which Canadians are contracting COVID-19, I think we need to recognize that in certain settings, it's easier to get the data. So it might actually skew the understanding, and people might think, oh, it's happening in schools. Oh, it's happening in a long-term care facility. But if you step back and think about, well, of course, if you look at a school setting or let's say a long-term care facility, you have a set population. They're constantly under, quote, supervision, or the same people are always there every day. And therefore, if a case, should a case occur, it's much easier to identify the case, and say, aha, that's that person in that particular facility, and obviously, hopefully do the right contact tracing and follow-up measures. When we are looking at other types of settings, that say, for example, bars and restaurants, if we find a case afterwards, and they've been in sort of other settings where, it's not a fixed population, people move about and so on with mobility, it's more difficult to actually then pinpoint, say, oh, yes, it's for sure that this person picked up their infection because they actually had dinner at this restaurant at this time. That's practically impossible to do, and that's the challenge. Certainly, we found that, a third or so of cases that we've had data that we've received at the Public Health Agency are what we call sort of unlinked, or that there's no known source. And so we're getting reports that, yes, sometimes it's private gatherings, it's sort of parties at home. Some people, yes, they've acknowledged they've been to a bar or restaurant. And that's the part I think that's challenging. And I think at the end of the day, we just recognize that really it is mobility, and the fact that people are still in a larger degree in contact with others compared to, let's say, the spring. I've mentioned before that when we had confirmed cases reported to public health back in the spring, and contact tracers went to those people and said, okay, so who have you been in contact with for the past 2 weeks? They might mention, 4 or 5 people. I think, obviously, I think my neighbor next door, and my adult child who came to visit me. What's happened since then, let's say into September and moving forward, when they've had confirmed cases, the number of contacts identified are 20, 30, 40, 50. So I think people need to step back and think, wow, if I were to keep a personal diary from here on in terms of who I come in contact, would I be embarrassed, tomorrow or the next day if suddenly someone, told me I had COVID-19 and I had to be able to recollect or give the list of everyone I've been in contact with for the past 14 days. So that's something I think everyone needs to reflect on and not focus on the settings and so on. I think it really comes down to everyone taking, I think, personal accountability for what they're doing.
So given that we have such little data on how it is spreading outside the settings you talked about, schools and LTC homes, why is it that the first thing we look to close down seems to be restaurants and stores and retail? Do we have any evidence that it's spreading there, or is there some other reason other than that to close those settings as sort of the first line of defense to slow the spread if we don't know that it's spreading there?
Well, I would say that certainly with the evidence, and we've talked about the 3 C's, crowded places, close contact, and so on and so forth. I'm not going to repeat all that. It just stands to reason that a setting such as an indoor space like a restaurant or bar, but then also the same thing in terms of a private residence. Those are places where transmission can occur. And certainly we recognize with our winter, people will be going more indoors, and certainly the situation is not ideal. So all of the basic public health measures, the hand washing, the use of face coverings, physical distancing, that's very important. The fact that we don't maybe have more fulsome data in terms of bars and restaurants, there have been documented, outbreaks, and I think there is sufficient data. That's how we actually have the scientific evidence to recognize that those types of settings, the closed indoor spaces with poor ventilation, are the settings in which the virus can be transmitted. So what I think I would say is that it's not that we're singling out any given sector. To the extent that Canadians take it upon themselves and recognize that their daily activities, in terms of what they do in their own private residences, who they get in contact with, family members, neighbors, and so on, has a ripple effect. Because, we've been telling everyone for the most part, hey, stay at home, limit the number of contacts, and so on. But that becomes an issue of personal behavior. When that seems to not be working because case counts go up and then hospitalizations and so on, then the only sort of tool left, let's say, for governments and public health authorities is to put the hammer down and do what they can control, which is obviously the closing of certain settings in the private sector, be it restaurants, bars, and so on. But that's, I think, a last resort because if you look at the experience of other countries, if you go into, quote, a total lockdown and really limit people's movement and ability to be in contact with each other, with curfews and so on, yes, the case counts will go down. But we know there's a tremendous cost to that, both socially and economically, and that's what we're trying to avoid, trying to find that balance, a more targeted approach. But I would say in a perfect world, if everyone did what they really could or should be doing, really limit the number of contacts and only go out for, let's say, essential activities like grocery shopping, once a week and so on, then I would say that the incidence rate of cases should be going down, and then we wouldn't need to be in a place where governments have to make those tough decisions with lockdown measures or closing bars, restaurants, as you mentioned.
Merci, Dr. Njoo. Thank you. On va prendre une dernière question au téléphone. Operator.
Thank you. The next question is from La prochaine question est de Ryan Tumulty from National Post. Please go ahead. À vous la parole.
Yeah, I believe this question is for Minister Bains, but anyone should feel free to answer. The Prime Minister this morning said that we may be a little delayed on vaccines because we do not have domestic production capacity here in Canada. I'm wondering what steps the government has taken to address that problem and why they're not, I guess, leading to results now.
Well, thank you very much for your question. We recognize at the onset of this pandemic that it was important to build up domestic capacity for personal protective equipment and for the ability to support Canadian solutions for therapeutics and vaccines, and also to build up our biomanufacturing capacity. And since March, we made significant investments to that endeavor. We've invested in the National Research Council facility in Montreal as an example to build up that domestic capacity to manufacture vaccines here. The AbCellera announcement today, for example, speaks to the investments we're making in the Vancouver facility for therapeutics. We also made investments in Vito Intervac in Saskatoon, and we'll continue to provide updates on these investments, but it's going to take some time to build up domestic capacity, but it is a priority and part of our Made in Canada solutions that we highlighted in March. And we've seen improvements if you look at procurement, for example. We virtually had 0% procurements made with Canadian suppliers and local solutions. We're up to approximately 50 cents on the dollar, approximately 50% of the investments that we're making in procurement are Made in Canada solutions. So we have that same mindset when it comes to building up our domestic biomanufacturing capabilities, and we'll continue to make those investments on a going forward basis.
Anita, would you want to say something?
Sure, you read my mind, Jean-Yves. I wanted to mention also that Nav's comments very well taken, and the fact that we have been able to put in place bilateral agreements with 7 of the world's leading vaccine candidates and access through 6 candidates through the COVAX facility, providing Canada with up to 414 million doses, speaks to Canada's ability to do 2 things at the same time: build up the domestic capacity that Nav is referring to, but also to put in place contracts of a complex nature to ensure that Canada has the most doses per capita of any country in the world. So what we're doing, Nav and I and the rest of our government, is to ensure that we're operating on multiple tracks at the same time. The $126 million investment in the Royal Mount facility for biomanufacturing that Nav referred to is one prong, but continuing to put in place complex contracts for vaccine procurement regardless is another. Thank you.
And if I may just add that not only do we have twice as much per capita of doses than any other country, the next country is Australia. It has half as many doses per capita as we have secured, but we also have, according to experts, one of the best portfolios of vaccines. And I think we're seeing this increasingly demonstrated by what is happening with the news from Pfizer, Moderna, and AstraZeneca.
Thank you. Minister Ryan, follow-up?
Yeah, I'm understanding what you're saying about the diversity and the size of our vaccine portfolio, but the Prime Minister was pretty clear today that despite that, we're going to get them after other countries. And so I'm wondering why there wasn't a bigger investment made in vaccine production here in Canada to address this problem, or is it just an issue where money wouldn't have solved this problem?
Well, thank you very much again for your question. And we need to recognize that building these complex biomanufacturing facilities takes time. And that is why we made the investment in the National Research Council Royalmount facility, which will be able to produce 24 million doses a year. So we're confident that we are starting to build that capacity domestically, and we've made the investments. But as the Prime Minister alluded to, the vaccines that we may have access to that are effective and safe are international vaccines that we're going to have the logistical process in place that my colleague, Minister Anand, talked about. So we're confident, I think if you're a Canadian listening to us right now, to say is that not only do we have made in Canada solutions and capacity here in Canada, but more importantly, if a vaccine is made available, that we're going to do the due diligence with the approvals with Health Canada, as well as make sure we have the logistical framework in place to make sure Canadians have access to safe and secure vaccines. And that's been the objective. And so it's a combination of supporting made in Canada and domestic biomanufacturing capabilities, as well as partnering up with our international suppliers as well.
Merci, Monsieur le Ministre. Ceci met fin
And
à la
just to
conférence.
build on that,
Go ahead, Minister.
sorry, just to build on that excellent point that Nav made, I want to stress that we aren't sitting on our heels waiting for Health Canada approval. We are in constant touch with our vaccine suppliers to ensure that when Health Canada approval has been obtained, we can have a very quick turnaround in terms of vaccine delivery. We're working on that every day, and we will continue to update you as we can. Thank you.
Merci, Madame la Ministre. Ceci met fin à la conférence de presse. Thank you, everyone.
Thank you. Merci.